If your patient ever says something along the lines of, I think I'm going to die, you should be taking that very seriously. This is called impending doom, and it's very much a real thing in the nursing world. Impending doom is that feeling of impending doom, like something bad's gonna happen, you're gonna die, you're gonna pass out, something not good is going to happen to you. There's a lot of reasons people may feel this way, but typically from what I've seen, when patients are saying things like, am I gonna die? I think I'm gonna die. Something's not right. They're usually right on track. Nobody knows you better than you know you. And so when patients say things like this, I assess them immediately and take them very seriously. Sometimes your patient might just be anxious, but a lot of times there's something else going on that maybe we can't quite see yet, like outwardly, like vital signs, labs, etc. But later on our shift, it's going to make sense as to why the patient was feeling this way. But whenever I have a patient say something along the lines of, I think I'm going to die, I always look into things further, keep a close eye on them, check more vital signs frequently, take a look at their labs, see if we need to add anything on, any other tests, and definitely communicate this to the provider. Have you ever had a patient with impending doom? Let me know, and let me know how it transpired and if anything ended up happening.